Hi everybody, so this is a video that pertains to the last part of the axial skeleton, which includes the vertebral column and the rib cage. So the first part of this video is going to go over the vertebrae, and then we'll go on to the rib cage. So these first slides that cover the vertebrae pertain to bony markings that are common to all of your vertebrae, all the vertebrae of your vertebral column. So it's very important when we look through these bones, by the way, that we always keep anterior and posterior aspects of the bones clear, because it's so important to visualize these bones as they are actually oriented in the body, all right? So we are looking at a superior view of a prototypical vertebrae. Specifically, it's a thoracic vertebrae. That's happens to be the vertebrae that we're using to demonstrate all of these universal bony markings that are common to all the vertebrae. As you can see, I have anterior and posterior, all right? The parts of this bone, this vertebra, that are oriented with respect to the front and back of the body are evident for you. So this first bony marking here that's towards the front, or at the anterior aspect of this bone, is the body. So all of the bodies of these vertebrae, as they're stacked upon one another, are all lined up carrying the load of your vertebral column. And they are all towards the front, the anterior aspect of the vertebrae. Now, before we start any further, I want to go over this big hole in the middle of the vertebra. All right, spoiler alert, its name is the vertebral foramen. And as all of these vertebrae are lined up upon one another, so too all these vertebral foramina are lined up, creating this long canal, and that's the canal where your spinal cord is going to go. So these first, or I should say second, sets of bony markings are going to surround this vertebral foramen, all right? And the first set that I want to focus on are the pedicles, which are directly attached to the body, right? So they are going to start to stretch around and surround the anterior aspect of this vertebral foramen. And then more towards the posterior aspect of the bone are going to be your lamina, all right? So together, the pedicles and the lamina are going to partially surround this vertebral foramina. They're also going to give structural reinforcement for some other bony markings, all right, that are distributed between them, which we are going to go over just a little bit later. So the combination of your lamina and your pedicles are known as the vertebral arch. So as you can see, I have now both the lamina and the pedicles colored in purple, right? Because originally I had the pedicles in blue and the lamina, or rather, I'm sorry, the pedicles in red and the lamina in blue, and everybody knows that when you mix purple, I'm getting ahead of myself, when you mix red and blue, you get purple, all right? So to show you that a combined bony landmark, all right, that is both the pedicles and the lamina, all right, combined together is known as the vertebral arch. All right, and we call it an arch because it's a architectural feature that is supportive in nature. All right, it's going to lend structural support to the bones surrounding the vertebral canal, and it's also going to act as kind of like glue that holds together or holds in place other bony landmarks, other components of this bone. So right here, again, this is the vertebral foramen. When all of these vertebral foramina are all lined up in orientation with one another, they create this big long canal known as the vertebral canal, and that's where the spinal cord is going to go. All right, so wedged between the space between the pedicles and the lamina are going to be these two antler-like processes coming off in a lateral trajectory or away from the midline. These are your transverse processes, And then between the two lamina in the back, at the very posterior aspect of the vertebra, is going to be the spinous process. So you have two transverse processes and then a singular spinous process. The transverse processes are between the pedicles and the lamina, and then the spinous process is just between the two lamina. Then also wedged between the pedicles and the lamina, right, just superior to your transverse processes are going to be your superior articulating processes. Superior articulating processes. And then we've turned the bone to the side. All right, and so now you can see anterior and posterior listed before you with parentheses. And again, you can see how the body is towards the anterior aspect of the bone. And now we're going to point out to you the pedicle. This happens to be just one pedicle you're seeing. The other one's going to be on the other side of the bone. And then right here, you're just going to see one of the transverse processes coming out at you. Right? The other transverse process is going to be on the other side of the bone. And then here we show you the spinous process. Now, the spinous process of the thoracic vertebra is unique in that it points down at a very sharp angle. That's not the case with the cervical vertebrae and your lumbar vertebrae, and we'll talk about that coming up later. But what I really wanted to show you with this view is the difference between the superior articular processes and the inferior articular processes. So you're looking at one side of this vertebra, so you can only see one of each of these processes. So you see at the superior aspect, one of the superior articular processes, and then at the inferior aspect, just below the superior articular process, you see an inferior articular process. All right. So again, on the other side, there's going to be another inferior articular process. So these inferior and superior articular processes are basically above and below the transverse processes. Right. And like we said before, the transverse processes are kind of wedged right there between the pedicles and the lamina. So here what I've done is I basically took an entire skeleton and I put it laying on its ventral side on one of the tabletops in the lab. And then what I did is I highlighted the different vertebrae for you. So here in your neck, you have your cervical vertebrae. Remember, cervical means neck. There's 7 of them. And then here in purple, you see your thoracic vertebrae. We were just looking at a thoracic vertebra as our prototypical vertebra. And there's 12 thoracic vertebrae. And then here are lumbar vertebrae, of which there are 5 in orange. And then sitting atop, all right, or I should say a better way to phrase this is sitting just below these lumbar vertebrae is the sacrum. So the lumbar vertebrae then rather sit atop the sacrum, and the thoracic vertebrae are going to sit atop the lumbar vertebrae, and then the cervical vertebrae are going to sit atop the thoracic vertebrae. So that's how the whole spinal cord is going to be, not spinal cord, misspoke there. That's how the whole vertebral column is going to be stacked, all right, upon itself. So we start off with the foundation, which is the sacrum, the 5 fused vertebrae in green, and then comes your 5 lumbar vertebrae, and then comes your 12 thoracic vertebrae, and then atop that becomes your 7 cervical vertebrae. At the inferior aspect of the sacrum is your coccyx, which is 4 to 5 fused bones. Your coccyx is otherwise known as your tailbone. But remember, for the practical, you're not going to write tailbone. You have to use the word coccyx. So this is a word you might want to write out over and over and over and over and over again. Not a word we use in our everyday language. So just make sure you watch the spelling on that particularly. So now what we're going to do is we're going to look at distinctive features of specific types of vertebrae. And we're going to start off with our cervical vertebrae. And what we're doing is we're looking at one of the cervical vertebrae from below. So we're looking up at it. And the reason why I chose this view is because this is the best view to see all of the special features we need to see. So again, anterior and posterior is listed for you with parentheses. So you can always kind of keep track in your mind of how this bone would be oriented in the body. So what I want you to pay attention to first and foremost with the cervical vertebrae are the transverse foramina. All right, they're transverse foramina. So the transverse foramina are associated with your transverse processes. Each transverse process is going to have a transverse foramen. And you can see here in this image, I have highlighted each of these transverse foramina in red for you. The transverse foramina, by the way, are going to be carrying your vertebral arteries and veins. All right, and you're going to learn more about the vertebral arteries when you take AP2. The vertebral arteries are going to be supplying blood to the posterior side of your circulation to your brain, essentially. All right, it's going to be ultimately supplying blood to your spinal cord and your cerebellum, and or did I say spinal cord? I meant your medulla, your cerebellum, your midbrain, and the posterior aspect of your cerebral cortex. All of those parts of the brain, which you're going to go over later in this course, are going to be supplied by your vertebral arteries, which are traveling through these transverse foramina. The spinous process is unique in the cervical vertebrae in that it is bifid, meaning it has two little points to it instead of one point. They have a very small body, and the reason why you have a small body in the cervical vertebrae is because they have less weight to carry than lower vertebrae, all right? Because as the vertebral column is built, as these vertebrae are stacked upon themselves, each individual vertebrae has less and less load to carry, right? It's the vertebrae right at the very bottom that has the most load to carry, but as we go higher and higher and higher, we have less and less and less load to carry, until finally, the cervical vertebrae, they only have to worry about carrying the load of the skull. Okay, so this happens to be your first cervical vertebrae, which is your atlas. And by the way, all of these vertebrae can be abbreviated first with a letter, all right, which stands for the type of vertebrae that they are. So the letter we're going to use to abbreviate the cervical vertebrae is going to be C. And then we follow this letter by a number. And the number is going to indicate the ordering of the vertebrae. And we always start from the top. So the very superior most cervical vertebra is going to be C1. And then below that is C2. And below that is C3. And then below that is C4. All right, C5, C6, C7, stop. That's all of our cervical vertebrae. And then comes our thoracic vertebrae underneath that. We symbolize the thoracic vertebrae with the letter code T. So the first thoracic vertebra is going to be T1. And then below that, T2, T3, T4, T5, T6, T7, T8, T9, T10, T11, T12. Stop. We have 12 thoracic vertebrae. And then below that, we have our lumbar vertebrae, the first or superior most lumbar vertebrae, L1, all right, and then followed by under that is going to be L2, and then L3, and L4, and L5, and that's going to be our lowest or most inferior lumbar vertebrae sitting atop our sacrum, all right? So that's how all of these bones are going to be abbreviated, so we need to get used to that. So our superior most vertebrae of the entire vertebral column. Also, our superior most cervical vertebra is going to be atlas, otherwise known as C1. Atlas is going to be holding up the load of the skull directly. Here's a lateral view of atlas, and then here we have a lateral view from the other aspect. Right here we have axis. This is C2. This is the vertebra that's just below atlas, right? A distinctive feature of axis is going to be its dens process, which is this little hood ornament that sticks up from its body. And we'll see how the dens process plays a critical role in the articulation of the atlas and the axis coming up in the next few slides. So here's just a lateral view here to give you a better view of the dens process. And then here we have the atlas and the axis stacked upon one another. So here I have highlighted the atlas for you, and then here I have highlighted the axis for you. And you can see especially that dens process right there sticking up from the axis. Now, basically what happens is that the atlas has superior articular processes, which are very broad and flat, and they are going to articulate with your occipital condyles. Remember, the occipital condyles are those blade or knuckle-like processes that are going to be at the inferior aspect of your occipital bones, right, on either side of the foramen magnum, the big hole. And so as those occipital condyles articulate with this atlas, all right, movement upon these joints is going to allow you to nod your head, all right, in order to say yes. All right. Now, what happens further is the atlas then can swivel back and forth upon the axis's Dens process as kind of a pivot point. All right, so basically what can happen is this atlas can move this way and then this way using this Dens process as a swivel point. And essentially its little tiny body just kind of loops right around that axis and basically acts like a hook that kind of surrounds it. So amazingly, the atlas's articulation with the axis is going to allow you to say no, to swivel your head back and forth. All right, so again, the atlas's articulation directly with your occipital bone of your skull through its superior articulating processes, articulating with the occipital condyles of the occipital bone, allow you to say yes, to nod your head, whereas the atlas's articulation with the axis, with this unique arrangement, so it's able to pivot back and forth upon the Dens process of the axis, allows you to say no, to turn your head from side to side. So again, we have the Dens process highlighted here with this slide. We're going to talk about distinctive features of the thoracic vertebrae now. So again, we have this very steeply pointing downwards spinous process of the thoracic vertebrae. That's the most notable feature of the thoracic vertebrae. You have a larger body because you have a larger load to bear. You have to bear the load of possibly thoracic vertebrae above, and then all of the other thoracic and or cervical vertebrae stacked upon them. Other distinctive features are going to be the facets or flattened components that correspond with where these bones articulate with the ribs. Remember, the thoracic vertebrae are going to be associated with your rib cage, right, your thorax. And so it makes sense that we have regions that are specialized for articulating with those ribs. It's how the ribs are going to attach to the vertebral column. Now here's some distinctive features of the lumbar vertebrae. We have a more bulky, box-like spinous process and the largest bodies of all the vertebrae, right? Or at least the largest bodies amongst the lumbar, thoracic, and cervical vertebrae, all right? The sacrum, which is really 5 fused vertebrae, has these sacral foramina that your spinal nerves are going to travel through. It also has this enlarged region anteriorly that kind of bows out, called the sacral promontory. Upon the sacral promontory, that's where your 5th lumbar vertebra is going to go, and then the rest of the vertebral column is going to be stacked upon that. The coccyx, like we said before, is 4 to 5 fused bones, just inferior to your sacrum. So one thing I wanted to point out to you with this anterolateral view of the vertebral column is going to be your intervertebral discs. So your intervertebral discs are very organized structures containing fibrocartilage, which adjoin the bodies of the vertebrae. So it's these intervertebral discs that are going to allow you to have flexibility of your vertebral column. You're going to talk more about that in lecture. Between the pedicles, you're going to see these holes or gaps between adjacent vertebrae known as the intervertebral foramina. Here you just have one labeled, so we call it an intervertebral foramen. You guys know by now that the prefix inter means between, and vertebral refers to the vertebrae, of course, right? So these are just these gaps or holes between adjacent vertebrae. And it's through these gaps that spinal nerves are coming out. Much like the sacral foramina, here between the vertebrae of the vertebral column, within the intervertebral foramina, you also have spinal nerves coming out. And then, of course, we have the spinal nerves in yellow labeled here for you. And then now we have the rib cage. So the rib cage anteriorly is defined by the sternum, or your breastbone. The superior marking of the sternum is known as your manubrium, which I have highlighted in blue for you. Then this middle marking in purple is your body. And then the inferior most marking is the xiphoid process. This is a word you may want to write out 50 times or so, all right? Not a word that we use every day, very easily misspelled. So this is one you want to pay close attention to. So we have our ribs articulating anteriorly to the sternum via these stretches of hyaline cartilage known as costal cartilages. So the ribs don't actually directly attach to the sternum. Instead, they send out these stretches of hyaline cartilage known as costal cartilages. By the way, the word costal, that just describes anything that has to do with the ribs. So the rib pairs, that is specifically 1 through 7, which have costal cartilages which directly attach to your sternum, are known as your true ribs. All right, so I have all of your true ribs highlighted in this kind of like moss green here for you. And you can see that I have the rib pairs numbered for you as well. And these ribs are also known as your vertebral sternal ribs because they directly connect to the sternum. And you can see that I have their costal cartilages outlined in the green dots now for you, just to prove to you that all of these costal cartilages are in fact directly attaching to the sternum. Now, your false ribs are the remainder of the ribs. So you have a total of 12 pairs of ribs, right, normally. And so it's 8 through 10, all right, or rib pairs 8 through 10 that constitute your false ribs. And there's 2 groups of false ribs that we have to go over. By the way, I have all of your false ribs highlighted in fuchsia for you, just so there's no mistaking. And I also have them numbered. So wherever I could, wherever gaps were present, I filled in the numbering so you guys could identify these rib pairs. Now, this is where it gets a little bit complex. Ribs, or I should specify rib pairs 8 through 10, all right, have costal cartilages as well, but these costal cartilages fuse together and then insert into the costal cartilage of rib pairs number 7, all right? So the last set of vertebral sternal ribs. All right, these ribs, that is rib pairs 8 through 10, are known specifically as the vertebral chondral ribs. All right, it's almost like they have a shared driveway, all right, that's the result of all of these ribs fusing together, and then it ultimately ends up fusing into the costal cartilage of rib pairs number 7. Then this last set of pairs of false ribs are known as your floating ribs because they do not have any costal cartilages associated with them. They're just kind of floating there. And so these are rib pairs 11 and 12. And yes, some people are missing rib pair 12, all right? That's not, enormously uncommon. But for the most part, normally we do have 2 of these pairs of floating ribs, pairs 11 and 12. All right, and that's it for the remainder of the axial skeleton. So I will see you guys shortly where we will review the remainder of the skeleton, specifically the appendicular skeleton. All right, so I will talk with you very soon. Until then, bye.